Okay, so with typical antipsychotics that we covered in part I, you need to watch out for EPS symptoms, take with food, assess for cheeking, the pocketing so they can get rid of it later. Stress, medication compliance, so critical. Avoid sun exposure, get up slowly, good oral hygiene because of the anticholinergic effects. That's traditional or typical. Let's talk about atypical medications, which could be risperidol or risperidone is the generic. Zyprexa is a brand name for olanzapine. Seroquel is a brand name for quetiapine. Abilify is the brand name for aripiprazole. Let's just call that Abilify. And you'll see that advertised on TV actually as an adjunct to depression treatments. So these are atypical. And let's talk about how they are different. These are more associated with weight gain. Hyperglycemia, so it will aggravate diabetes. Orthostatic hypotension. Most may be taken without regard to meals. Remember, the traditional or typical need to be taken with food. Atypicals, food isn't a factor. Therapeutic effects will begin in as early as 2 weeks for the risperidone or risperidol. Geodon is a newer atypical agent. Less weight gain. Does have heart effects. It prolongs the QT intervals. So you need an EKG, electrocardiogram, before you begin taking the drugs. Contraindicated with pregnancy. History of severe heart disease. Used cautiously with renal disease, hepatic and cardiovascular disease, and may cause a fatal type of ventricular tachycardia. So Geodon used carefully. Atypical antipsychotics, again, normally cause weight gain. There's an association between the use of these drugs and hyperglycemia and diabetes. A causal relationship, in other words, one causes the other, between the use of the drugs and diabetes has not been established. Right now it's only correlative. It's like if they take the atypical antipsychotics, they're commonly also taking diabetic medication, but there's no proof that one causes the other. We'll always be checking the client's blood glucose levels periodically during the therapy. One of the factors that causes noncompliance is the high cost of these medications. Most common side effect from Geodon is constipation. Another reason people would stop taking it. Antipsychotic drugs should decrease agitation and hostility within 30 minutes of taking them. Atypicals, atypicals key in on diabetes and cardiovascular. Those are the key things there. So we have a chart on atypical antipsychotics. And you can see from top to bottom, the first two cause a lot of weight gain, the bottom ones much less. And that corresponds with the diabetes risk and the dyslipidemia. However, when we move down that chart, we're having more cardiac effects. Again, medications are chosen based on what's going on in the patient already. If a person has heart disease, are we going to take quetiapine or risperidone? Probably not. If they already have diabetes, are we going to give them clozapine or olanzapine? Again, probably not. Medical treatment and nursing treatment is all about understanding the person, not just these symptoms, but what else is going on with that person. What might cause them to stop taking it? If the person has no job and no income, are we probably going to have luck giving them a very expensive medication? Probably not, unless there's a community resource that we can find for them. So, nursing and healthcare, it's understanding and asking questions about everything, not just how do you feel today? How do you feel today? Where do you work? Where do you live? Do you have a support system? Is there a history of this in your family? A lot of information that's needed before you can actually decide what to do. So, atypical antipsychotics, indication are for decreased manifestations of schizophrenia, positive and negative symptoms, and acute bipolar mania for some specific drugs. They block specific dopamine receptors and serotonin receptors. They do alpha-adrenergic blocking, and they do have anticholinergic activity, especially some of the drugs like Zyprexa. Atypicals, because they're used for the positive and negative symptoms, they will improve social interaction and speech. That's important. So if a person is totally withdrawn, doesn't talk, atypicals will help that. Side effects, again, we're back to EPS and NMS. Sedation, prolonged QT intervals. That's that dangerous ventricular tachycardia. As with everything else, orthostatic hypotension is possible. Tachycardia, dry mouth, constipation, all those things from the anticholinergic effects. Weight gain, and of course, as I mentioned several times, may worsen glucose control. So you could see elevated blood sugar levels, which will have its own set of problems. Patient considerations. What are we going to have to teach the patients about these medications? Avoid activities that cause mental alertness if your medication causes dizziness. Avoid other CNS depressants and alcohol. Avoid abrupt withdrawal to prevent EPS. Heat stroke is more likely. Falls are more likely from orthostatic hypotension. Monitor your blood pressure. Monitor weight gain and or diabetes. Antipsychotic medications are important. They do a really important job to bring people back to society. But as nurses, we have to be very aware of what else can happen because of these medications and how the side effects can lead to other problems. We are always looking for what can we do to help the person become whole again, not just let's fix this problem. So why don't you come back for epilepsy?